Seven, 6, 5, 4, 3, 2, 1.
Hi, everyone, and welcome to episode number 79 of CBD Talk Podcast. First of all, get some homework done here. Tonight's episode is sponsored by yourlogocbd.com. Their wholesale private label, white label, and drop shipping of the hottest selling CBD products. Actually, I use their products, so I can attest to the quality. So if you've got some wholesale CBD needs, head on over, check them out. yourlogocbd.com. Okay, now tonight, I was supposed to ask you how to pronounce your last name before I started.
I'll spell it phonetically for you. Sauce now. Sosnow.
Oh, Sosnow. Awesome. Okay. I had actually done a Facebook Live real quick before we started, and I told them I would find out how to say your name. So we have with us veterinarian Dr. Joshua Sosnow from Companion CBD. And the reason that I have him on this evening is I was able to take a continuing education course for veterinarian techs or what have you. And Dr. Sosnow here was the one who presented it. And there was a lot of great information. And I'm very excited to have him with us to share some of that with us tonight. So how about first, can you tell us how you found out about CBD?
Well, approximately 2 years ago, I was approached by a friend who happened to be working with a CBD company based in Colorado. And this company wanted to learn more about the use of CBD in veterinary patients. So together with them, I started to immerse myself in what little published literature exists on the veterinary side and then in the human literature. And it ended up causing me to actually design a study, which we ran at about 10 clinics around the country, looking at CBD and how it affects veterinary patients with osteoarthritis. From that experience, it mushroomed into me using it extensively in my practices. And starting to, use CBD, not just for osteoarthritis, but for a whole variety of conditions. And here we are, fast forward 2 years later, it ended up causing myself and a partner to get into the CBD business, recognizing that there was an opportunity for, there was a need for CBD-based products that were better suited to treating patients and that were dosed appropriately, that were actually taking advantage of what literature was out there.
That's excellent. And it really is something that can be difficult for pet parents figuring out how to dose CBD. So are you able to, when people purchase from you at companioncbd.com, are they able to call in and ask questions?
Yeah, actually, we're starting to launch a platform that will allow essentially a live chat, an exchange of ideas. And, we typically sell our products to veterinarians because it's our contention that there's so much variability, not only between individuals, but variability in the dosing with different types of diseases, that there's some guidance that's necessary. So we also offer that to veterinarians because for veterinarians who are somewhat unfamiliar with the product or the class of compounds, we want to give them the best advice that we can and try to guide them in their use of CBD so that ultimately their clients and patients get the best result.
Yeah, it having the veterinarian there in the conversation is huge. It's huge. But I also know that in some states that is a dangerous thing to do. I know in California that they were able to pass a law. But what is it the AVMA that is your ruling body? What's their stance
Correct.
on that?
The American Veterinary Medical Association recently gave a webinar which discussed some of the regulatory concerns, and their position was the same as the FDA currently. That is to say that technically CBD, whether it's human CBD or veterinary CBD, all CBD right now is technically an unlicensed drug. Therefore, as a licensed practitioner of medicine, their feeling at the moment was that veterinarians should be cautious and not consider using their product until more literature came out and until the FDA clarified their position about CBD. Now, as you can see, the CBD industry has exploded despite this position. And what we're beginning to see in veterinary medicine is more and more veterinarians recognize the fact that the FDA is likely to find a reasonable path forward. And therefore, as long as there's no law preventing them from getting involved with CBD or recommending CBD to their patients, many of them have decided to move forward despite the AVMA's position.
And I truly appreciate that, because there are so many pets that can benefit from CBD.
It's one of those things that, we can bring to bear in a lot of different conditions, and it carries with it little risks. So people really like to consider it as an alternative, especially if they're talking about the possible need of medicating a patient long term.
Now, do you, when you're working with the patients, what mode of what type of product do you use? Are you using a tincture? Are you using a chew? What are you using?
So I preferentially use the product that's manufactured by Companion CBD. It's a soft chew, and it uses CBD isolate. And what we're finding is all of the research, certainly on the veterinary side, and admittedly a lot of the research on the human side, talks specifically about the amount of CBD that you would use to dose a particular patient for some sort of condition. And obviously there's a big discussion about the potential for an entourage effect. Certainly in my practices, we've had a large measure of success by using CBD isolate alone in the soft chew, but dosing it appropriately. And, there's a whole class of phytocannabinoids. We're not ignorant of the fact that many of them do potentially have therapeutic value, but we try to deal in the known. We try to deal with the science that's out there, both on the human and veterinary side. And therefore, we chose to make a product specifically with CBD isolate because we know the most about it.
That makes sense. That's wonderful. You've got the science and you're using it, so you can't ask for more than that.
And one of the considerations, particularly for pet owners, is the cost of CBD is still, it can be high, and unfortunately, the oils, especially high quality oils and concentrated oils, can be quite expensive. And we found that by using CBD isolate, it makes it a little bit more affordable for a pet parent.
That's great to have that in the back of your mind as well for your pet parents, because it's not like insurance is covering it. So one of the things that you had touched on during your continuing education unit class was the half-life of CBD. I don't think we've discussed that at all. So if you could touch on that and how they came up with it, the process, that they used to come up with the information as well, that'd be awesome.
So at least with respect to dogs, there's actually several published studies, the earliest of which was published back in 1988, that look at the half-life. And roughly speaking, the half-life of CBD is about 2 to 4 hours in the dog. There are currently studies ongoing, like at Auburn University, which are looking at say, the half-life in the pharmacokinetics in horses. And there are folks that are just on the verge of beginning to look at the pharmacokinetics potentially in feline patients. But what we find is that the pharmacokinetics, the way CBD is metabolized, is actually fairly similar to the way it is on the human side.
Interesting. Now, I understand that with respect to equine compared to canine, that one would think, because the size of a horse is so huge, that you would need exponentially larger dosages, but that's not true, is it?
Well, both on the human side of things and in the veterinary side of things, when we dose patients, we dose them according to their body weight. In other words, we look at the number of milligrams per kilogram of body weight. So while it's true that obviously a large 1,500-pound horse is going to require a large dose, we don't know yet, but it may turn out that the dose we use on a per kilogram basis might actually be quite similar. Thus far, we find there's a lot of conservation of the endocannabinoid system between a lot of different species. It makes sense because it's so critical to the sort of normal functioning of our bodies. So while we still don't have a definitive answer yet, you're right in saying that the doses required will be quite large, mainly because of the size of the animal. And one of the issues, obviously, there is cost. And until the cost comes down quite a bit, it's only going to be reserved for horse owners with a lot of discretionary income, or those that want to use it on an as-needed basis. But it would be quite costly to use it on a regular basis until the prices really fall.
So, what are some of the symptoms or diseases or what have you that you have found are respond well to CBD as a treatment?
So I think most of us that use it certainly find osteoarthritis, joint pain that comes about with age is probably the single most common use right now. With that, and I have to admit that in veterinary medicine, oftentimes it goes unrecognized, is we have something called neuropathic pain, pain that's more derived from the nervous system and how it perceives pain, that will oftentimes occur concurrently with arthritis. So we use CBD for that as well. Certainly in my practices, we've used CBD to manage certain types of cancers, both in dogs and cats. We've used CBD to manage patients with environmental allergies, otherwise known as atopy. Certainly patients that are beginning to demonstrate some sort of cognitive decline, we've used it to enhance quality of life. We find that another common use actually tends to be patients with certain types of anxiety. So, for example, a separation anxiety, or anxiety brought on by some sort of loud noise or noise phobia, even patients using it in patients when they're traveling to help keep them calm. Collectively, those are some of the more common uses, but we're starting to see people that are exploring it as a potential treatment option in patients that have different types of immune-mediated diseases. There's been some talk of using it as a sort of post-operative pain management tool, or even in patients that have sustained some sort of soft tissue injury. So, for example, I recently had a patient just this last week who was bit by a rattlesnake, and as a consequence, has a tremendous amount of soft tissue damage from the venom. So one of the tools we're using for the next few weeks to manage some of the discomfort and the inflammation associated with it is CBD. So as we go forward, I think there'll be more and more conditions, even certain GI conditions or gastrointestinal conditions, that we could potentially look at as candidates for CBD use.
I had to tell you, and I've mentioned it on the show, I have a almost 11-year-old dog, and a couple of years ago, he was diagnosed with diabetes. And so I finally got serious about using CBD with it, and for the last 60 plus days, I've given him CBD in his morning meal and his evening meal. And after 30 days, he went down and he gets shot in the morning, shot in the evening. He went down from 14 cc's per shot to 13. And then 30 days later, he went down from 13 to 12. And for the previous year, every time they were raising his insulin. And so now we're seeing it go down. So I'm going to keep doing it and see what happens.
Well, there actually, on the human side of things, there's been some publications that look at CBD as a way of, I guess you could perhaps say, enhancing the glucose sensitivity in a patient that has diabetes. But certainly on the veterinary side, that's very much on the leading edge of things. I can't say personally that I've had the opportunity yet to use CBD in a patient that had diabetes alone. In other words, have some patients that have the term we use is comorbidities. They have multiple diseases at once, but I haven't used CBD specifically in a diabetic.
Well, maybe you'll get the opportunity because I know I'm thrilled with it. And
I'm sure I will.
Yeah. So what, so you work a lot with the veterinarians. What kind of feedback are you getting from fellow veterinarians about your product?
The majority of veterinarians that have embraced it have found it very useful. It's by no means a panacea, and we don't sort of paint a picture that it is. But the majority of veterinarians have had good success with it. They think the feedback from their clients suggests that the product is really helping their patients, and they decided to continue to use it. And I think that while most of those veterinarians reach for it when trying to manage a patient with, say, osteoarthritis, I think now we're seeing some of them become more comfortable with it and willing to branch out a little bit to tackle some of these other conditions and see where it might play a role. So it's been warmly embraced. I mean, I can speak specifically to the numbers, and the people that buy our products continue to buy our products because they see value in it.
Yeah, and I love the fact that you talked about how you've used it with some patients with anxiety. I've heard a lot of positive things about that with animals with separation anxiety, with the fireworks and things like that as well, and thunderstorms. And I have heard about the osteoarthritis as well. Um, what are some animal studies that you know of that are ongoing right now?
Well, currently Colorado State has studies that are ongoing looking at the use of CBD for seizures. As I'm sure your audience knows, there is a FDA-approved drug that is a CBD-based drug that's approved by the FDA that's approved for use in children with certain types of seizure syndromes. So there's another study that's going on at Colorado State to look at CBD in the management of seizures. You certainly have studies at Auburn University looking at the pharmacokinetics or how CBD behaves in horses, and more studies taking place at the University of Florida. We're actually going to be starting some studies here in the summer at Midwestern's College of Veterinary Medicine, looking at several different conditions and how CBD can best be used to manage those. So little by little, you're beginning to see some of these institutions open up, albeit with a lot of oversight, but they're beginning to open up and allow practitioners and clinicians and researchers to explore the potential utility. So I think really in the next 12 months, we're going to see, at least a handful of publications come out discussing the use of CBD to manage a variety of conditions, and hopefully it'll only grow from there. But there's a lot of private corporations also that are engaged in financing and funding studies on their own, not in association with any type of university. And certainly, in veterinary medicine, we can garner a lot of information from those studies in the same way we do from those that are sponsored at the university.
And what's great also is if there is a study, then you have the opportunity to, for other scientists to duplicate it, and just adds to the nice big mass of knowledge out there for us all. You might want to take the phone a little bit further away from your face. There you go. Yay, we got the smile. So, oh gosh, I was going to ask you something. And I spaced. How about you just give us a refresher on the endocannabinoid system for a minute?
So the endocannabinoid system was poorly described, and one might even say that it was not really known prior to about 20 or 30 years ago. And it's a system that consists of a variety of receptors, enzymes, chemical messengers, signaling molecules, and even the interaction of the gut, the microbes in the gut. And collectively, it's used to regulate the body or to maintain what we call homeostasis within the body. You have elements of the endocannabinoid system in every organ system of your body to varying degrees. And there's admittedly, while we currently recognize about a handful of key receptors that are cellular receptors that are important with respect to the endocannabinoid system, in fact, there are literally dozens of receptors that have been identified that may act through this system. So the complexity of it is quite significant. And we're just beginning to understand all the different sort of pathways and ways that it can affect our body, and understand, I should say, where we have opportunities to manipulate it so that to our benefit. So, with that said, the other thing that's important is that this is a very basic system. I mean, you can find elements of the system in some rather primitive species, which clearly indicates how important it is to our basic overall function. If you look at graphics that describe all the body systems and the way it works, it's exhaustive at times to try to look at these things and really take it all in. But it is fundamentally a newer body system that we didn't recognize, that the phytocannabinoids as a whole, not just CBD, but THC and all the other compounds we talk about from the cannabis plant, potentially act through. And in fact, what we're also seeing is that other classes of drugs, things like opioids and non-steroidal anti-inflammatory drugs, also may actually produce their effects in part through the endocannabinoid system.
Since you mentioned that, I'm remembering what I wanted to ask you. When you're talking about the NSAIDs and the carprophens and things like that, what have you found with respect to contraindications with animals?
Well, thus far, I mean, what we have to draw on so far comes from the human side, and there are a couple of not very common, but there are medications that are used in veterinary medicine. Some medications used for seizure control, some medications used to treat fungal infections, for example. But aside from those, there are, if you will, hypothesized or potential drug interactions. I can say from my own practice, having used CBD in a whole variety of patients that are on, different medications, there seems to be very little cross-reactivity, very little risk of administering CBD with most of the common classes of medications that we use. Granted, we still have more to learn about it, but on the outside, there doesn't appear to be any untoward effects that are apparent both either to myself or to the clients that are using it.
Fabulous, absolutely fabulous. I'm guessing that you probably are, and I think you actually even mentioned this in the webinar. You're using it more, I believe, with dogs at this point than with felines.
We one of the things we did when we designed our products was we did some palatability testing with cats, and we do use it in cats. You'd be surprised how amenable they can be. We sort of figured that if they were going to eat the treats in the environment in the hospital, there was a pretty good bet they'd eat them at home when they were in their own environment.
Okay, everybody, go to companioncbd.com, get their cat stuff, because if they're that sounds good, and I will probably be doing the same.
So admittedly, there's not a tremendous amount of literature on which to draw. So we sort of extrapolated from what we know about dogs and other veterinary or animal species, and used a similar dosing regimen. And admittedly, we've had a mixed degree of success. We still have a lot more to learn about cats. Admittedly, cats are a little bit more finicky, and I don't know at times whether it's as easy for cat owners to discern a difference. In my experience, we've more often used it to deal with certain types of anxiety issues or stress-related issues. Admittedly, there's a huge opportunity to manage cats with arthritis because oftentimes osteoarthritis goes under-recognized in veterinary medicine. The other challenge with cats is that, we as veterinarians, we see them a lot less than we do our dog patients. So it's easier to, and admittedly, since owners tend to be a lot more active with their dogs, if there's a limitation on mobility, owners are able to perceive the difference with relative ease when they go on walks, when they play ball, when they go for a run, when they go through the motions of being a pet owner.
Yeah. I was hoping at some point to be able to, because I have a cat as well, and I was hoping at some point that there would be like a CBD catnip out there, because I know Grizz loves catnip. So I was thinking maybe I could soak like half of the bag of catnip in an isolate and then stick it back with the other part of the catnip and just like shake it up or something. But he loves his catnip. But oh my gosh, I've tried to give him tincture and he's just like looks at me like, you're insane.
Yeah, I mean the terpene compounds in oils are not. I mean, I don't consider them terribly palatable for most people, and you can imagine how a cat feels if you try to force this stuff in its mouth. So that was one of the challenges, and that's yet another reason why we decided to use an isolate so that we eliminated all the terpenic compounds.
Yeah, that's a wonderful idea, and you may have just heard him in the background coughing up a hairball, because I just heard him going. Bleh, bleh. So that's lovely. Thanks, Chris. We're all
timing
friends
is everything.
Here. Yeah. So what would you like the pet parents out here to know about CBD? And what if their veterinarian is not on board with it?
Well, I think that there's a little bit of patience they have to exercise. We as veterinarians are subject to more regulatory authority than your average person. I think I tell them that, there's a lot of products available. You can go on Amazon and you can find 101 different
Okay,
products. But
we don't recommend going on Amazon and
right. Well, I was going to say
okay.
that most of these products have no reliable dosing guidelines whatsoever. They're fairly weak solutions, and they're inexpensive, but you get what you pay for.
Exactly.
And I think that when it comes to dosing CBD, it's also important to realize the dose has to be titrated to the individual. We have certain guidelines we can use to start dosing, but it needs to be titrated to suit, your individual animal's issues. And I think that can best be done in consultation with a veterinarian, especially if there's other conditions that your veterinarian is managing. Again, there's always the possibility that something we do with CBD may or may not interfere with other medications. And, I think the other thing they have to realize is that we're still learning a lot about it. It's still a work in progress. We haven't figured everything out just yet. It will not cure everything that you throw at it.
It's not a magic bullet. Yeah.
Correct. It is another tool in our toolbox. It's a very flexible tool. It's a very safe tool, but it's just one more tool. I think that, it should be treated and I think I can say this, that most of the time, since many of my clients have already heard about or used CBD themselves, those clients that have used CBD in their pets come in oftentimes being disappointed when it turns out after talking with them that they weren't using inappropriate doses. They weren't dosing it as often as they needed to be. Now, they were admittedly following the guidelines on the bottle, but the guidelines on the bottle were made up. So this is where working with a veterinarian really comes into play. And I think if people do that, they're going to have a greater degree of success with the CBD products they use.
So are your products, though, available to the public?
We admittedly sell through veterinarians. And what I tell people is that if their veterinarian is not comfortable with it, then, if with a veterinarian's recommendation, we're happy to provide the product. I understand that obviously in some states it may be difficult for veterinarians to stock and carry it, but we've tried to give this to veterinarians because, again, we believe they're the people who are in the best position to make recommendations about it.
And so if their veterinarian has not used it at this point yet, and they're willing to give it a try, I'm guessing the veterinarian could also contact you for guidance in how to use it?
They can go to our website. I spend a fair part of every week talking to veterinarians around the country about how to use it. There's always a little bit of trepidation and apprehension at first. Some people still have to get past the idea that the FDA could come knocking on their door at any moment. While it's not a real practical concern, and I can understand how it could be a concern for some. So, I spend a good bit of time talking to people about it and providing information from like the race-approved lectures that you attended and other outlets, so they can develop a bit of a understanding about the endocannabinoid system that underpins the use of the phytocannabinoids, and then how they can implement it in their clinical practice.
How many veterinarians do you think you reach out to a year, either through the race webinars or in person or on phone?
It's a good question. I can say it's a lot based on the questions that I get. That sort of brief period after the webinars are actually live cast. But there's definitely, what I can say is there's a huge interest. There's a huge interest in CBD. I mean, most veterinarians have clients who are using it, whether they know it or not. And, are they using it correctly? Are they getting the most from it? I don't know. In some cases, I should say in most cases, it's certainly veterinarians are in a situation where they can at least have a conversation about it. But whether they can, sell it or provide it to their clients is a different issue. But more and more of them are receptive, and a lot of these sort of hurdles, especially since the Hemp Act of 2018 was passed, have been removed, since it's no longer a scheduled drug by the DEA.
Yeah, and I understand that veterinarians are very, very, very busy people, and to be able to set aside time to really dive in and try to learn about hemp and CBD, that would be kind of daunting. So at least they have the courses that they can attend, like the one that you provided, that you were in.
Yeah, I mean, we in doing so, we tried to provide just the facts, not to sell anything in particular, to give people, like I said, just a very brief education foundation, so that as this becomes more and more prevalent amongst pet owners and more prevalent in practices, there's a certain level of comfort that they can derive because they understand the basic physiology and pharmacology associated with it.
Mm-hmm.
We get taught those types of things in veterinary school for many of the drugs that we use, and we're trying to do that now with respect to CBD through things like these webinars.
That's wonderful. That's really wonderful. Okay, everybody. Want to thank Dr. Sosnow for some great information there. And if your veterinarian is not using CBD and it's something that you want to explore with your pet, make sure that you refer them to Companion CBD and get your veterinarian on board, hopefully, and you could be their guinea pig. So everyone needs to start somewhere. Anything else you want to share with us?
No, I just, if anybody wants to reach out, they can find all the contact information at our website, which is just companioncbd.com.
Awesome. Well, thank you very much for your time, everybody. Thanks for joining us, and we'll see you again next week. Stay happy and stay healthy.
Thank you for having me.
7, 6, 5, 4, 3, 2, 1.